Hi, this is Jill Murphy from Pharmacy Times. Before we get started today, one of our top stories on Pharmacy Times is about the role of pharmacies caring for patients with HIV. Today I'm speaking with Jessica Langley, Executive Director of Education and Advocacy at the National Health Career Association, about the importance of expanding the role of pharmacy technicians. How are you doing, Jessica?
I'm good, thanks.
Thanks for joining us today.
Sure.
My first question is, can you explain your role at the NHA and how you continue to prepare the next generation of healthcare workers with your company?
Sure. So, as you mentioned, I'm the Executive Director of Education and Advocacy, which is just a fancy title for a lot of things that I do for our organization. NHA itself not only supports pharmacy technician profession, but seven other allied health professions as well. And at the core of our business, we really started around producing accredited, nationally accredited, industry recognized certification or credentialing exams for those eight allied health professions that we serve. So we tend to partner with educational institutions, training facilities, vocational schools that are offering the initial training in the professions, and then they end that training with that assessment or competency measure, which then in turn is our credentialing exam. Um, Within the organization, my main focus is really in three main areas. So regulatory, which is a big one in the pharmacy technician space. As we know, each state regulates that scope of practice and the rules independently of each other. So it's a lot to take on all the time and to keep up with. So regulatory relationships. So ensuring that overall as a company that we are on trend and on par with what's happening in terms of news, industry trends, updates, regulatory issues, what are the hottest topics impacting both healthcare and healthcare education, and where those two actually kind of meet in the middle. And then lastly, it's on recognition. So a big thing that we like to do at NHA is, as these individuals are going through training programs, they're sitting for these national certification exams, it's very important about the jobs that they're getting afterwards. And that credential is a key piece when going and being hired by a healthcare provider or employer. And so part of what we do is help educate healthcare employers about the value of certification. What are industry credentials? What do they mean? What are they assessing? And what does that look like when an individual brings that as part of their resume? Um, Specifically to the pharmacy technician space, our goal is a little bit different. We are really looking and advancing what we're doing in our organization to be what we consider one partner for individuals throughout their entire pharmacy technician career. So when we talk about the entire learning life cycle, it may start with their training programs, which NHA offers training resources that can be used by schools, or even let's say like a retail pharmacy training program, or even an independent pharmacy owner that's looking to train someone to be a pharmacy technician. We help by offering online supplemental resources in that area. We also have a Pharmaceer math product that we see that dosage calculations are one of the hardest kind of skill sets or areas for individuals to pick up. So we've created additional resources to help with that. If you keep going through kind of the channel, the next step would be studying for and preparing for the national exam. So we have study guides, practice tests, obviously the exam that gets them certified to become a CPHT. And then after they're hired and they're working, we really want to ensure that they continue to have support and resources. So we're looking at developing continuing education, advanced skills training. Of course, we have career readiness resources available through our multiple blogs, and we're continuously trying to put content out there to help them kind of elevate themselves and kind of take their career on to the next level.
You make a great point there. And with that being said, like you said before, many employers in the field require certifications to help them have better job opportunities and job security. What is the importance of continuing these training programs and taking the exams for these pharmacy technicians?
Right. So certification really is kind of the foundation of a person's kind of entry point into a career as a pharmacy technician. Every year, NHA does a annual publication. It's called Access, and it's an allied health industry journal. And part of that publication every year includes data and research from surveys that we have done to employers about those 8 different professions that we serve. And so we're able to really gather some important data, and specifically around certification, since that's a key part of our business. And in Access 2020, the numbers came back, and for the pharmacy technician profession, 90% of employers either prefer or require certification of an individual upon hire or shortly after hire. So that's huge. It's the highest number out of all 8 professions. Obviously, that, takes into consideration a little bit on the regulatory and legislative side of it, because a lot of states require certification in order to become registered to practice in a state. But what people don't realize is that, yes, it might be a certification might be a box that we want to check to get a job, but it also shows personal commitment to the profession. So an individual that takes the time, to study and prepare and actually, register and go sit for this exam, it takes a lot of effort. So it shows a little bit higher level of dedication to that. Lifelong learning, again, is also very important. If you get certification, you have to maintain that. And by maintaining that, you have to complete professional continuing education every 2 years, 20 hours of it. So again, that allows you to stay up with what's happening in the profession, be up to date on the trends, the newest drugs, any other topics or regulatory issues that might be impacting the practice of pharmacy is always something, to be top of mind. And then also, I think the last piece is being able to have a diverse skill set is really important. So anytime that we can be multi-skilled, so if I was a pharmacy technician that not only knew the basic practice, but I could also do some, or was really good at inventory management, or maybe some other task within the pharmacy, that makes me more employable, more versatile in the environment, and just kind of sets me up to hopefully perform additional duties, roles, and responsibilities. All in all, trying to just kind of create and climb a career ladder within the pharmacy space.
And kind of like you mentioned before, this is such an evolving industry and you have to have a diverse skill set. How can your company and other organizations continue to expand the role of pharmacy technicians?
So expansion in pharmacy is a really hot topic right now. It's not only a discussion that's happening with pharmacy technicians, but probably even most important in pharmacist world, and wanting pharmacists to be seen as providers, of basic health care, and being able to be reimbursed for that, because we know most Americans live within 5 miles of a pharmacy, and they see their pharmacist or their pharmacy professionals way more often than they do their primary care provider. So the access that individuals and families have to their pharmacies is much higher than they would to your traditional, family practice or primary care office. So there's a huge opportunity and role that the pharmacy can play in the health and well-being of patients across the country. And so that's a huge thing to think about and to try and harness. And whereas these conversations have been happening, we understand that that parallel movement needs to happen together. So as the pharmacist kind of roles are expanding, that can't happen. They can't do a different skill set or different role or job function if somebody else doesn't come back and take a little bit of the duties that they were doing before. And so there needs to be a little bit of a transition that takes place. And as the pharmacists are elevated, so are the pharmacy technicians. So a couple of things have to happen though for that. There has to be trust between the pharmacist and the pharmacy technicians that they can do the roles and duties successfully and competently. So with that comes additional training that needs to be put in place. And then most importantly, the biggest piece is expansion in the pharmacy industry really hinges on regulation and legislation. So the states, the boards of pharmacy have to allow or have to put language in place that allows them to work within their specific scope of practice or to the top of their license is really a phrase that we're trying to push a lot in this particular space. big thing right now, I think, is we need combined efforts. We need combined voices to advocate for the expansion of pharmacy professionals, both pharmacists and technicians. Um, a key thing when we talk about having to change regulation and legislation is really around data and having the evidence to support and back up the positive movement forward. So if we can show the success via pilots or other states that have done smaller projects with that, that's really key in helping to move that forward and to demonstrate the positive abilities that technicians have. And of course, with that and having that data and that validity, then in turn gains the trust of the pharmacists, and hopefully then they can take on more leadership roles and advocate for the technicians as well.